নমস্কার, দেখছেন TV9 বাংলা। আপনাদের সঙ্গে আমি তন্নিষ্ঠা রয়েছি। হেলথ প্লাস অনুষ্ঠানে আপনাদের সকলকে স্বাগত। দক্ষিণ ভারতের অন্যতম শীর্ষ মাল্টি সুপার স্পেশালিটি হাসপাতাল যশোদা হসপিটালস, হায়দ্রাবাদ 1989 সাল থেকে আধুনিক চিকিৎসা প্রযুক্তি ও মানবিক যত্নের সমন্বয়ে কোটি কোটি মানুষের জীবনে এনে দিয়েছে নতুন আশা। সমাজিগোড়া, সেকেন্দ্রাবাদ, মালাকপেট ও হাইটেক সিটিতে 4টি অত্যাধুনিক ইউনিটে রয়েছে প্রায় 4000 বেড, যেখানে চিকিৎসায় নিয়োজিত বিশ্বমানের চিকিৎসকের দল। ক্যান্সার কেয়ার, কার্ডিয়াক, নিউরো, অর্থো, ট্রান্সপ্লান্ট সার্ভিসেসের সঙ্গে রয়েছে অত্যাধুনিক এমআর লিনাক ও রোবোটিক সার্জারির সুবিধাও। যশোদা হসপিটালস, হায়দ্রাবাদ, আপনার সুস্থতার বিশ্বাস, আপনার জীবনের নতুন অধ্যায়। আজকের আলোচনার বিষয় পার্কিনসন্স সমস্যা। স্টুডিওয়ে আমাদের সঙ্গে আছেন চিকিৎসক ডক্টর রূপম বরগোয়েন, নিউরোলজিস্ট, যশোদা হসপিটালস, হায়দ্রাবাদ, তেলেঙ্গানা। Sir, welcome to our show. Firstly, I would like to question you that what is actually Parkinson's disease and what are the symptoms of it?
Parkinson's disease is a neurodegenerative disorder which is actually seen commonly in older people. The cardinal manifestations are actually tremor. They become slow, they become rigid, which is stiff, and they have difficulty in balancing. So we see that very often in older people. Not everybody who got a tremor has Parkinson's disease, because there's a group called essential tremor. But by and large, they have Parkinson's disease. This is the second commonest neurodegenerative disorder after Alzheimer's dementia, where people tend to forget, they have memory lapses, and then they go down slowly. Now, the beauty of Parkinson's disease is that it's become quite a lot manageable, treatable. Okay. Patients do get better as far as their day-to-day life is concerned. While we cannot actually stop it from progressing, they get better, and we can actually keep them functional for 10, 20 years. The younger patients who get disease around 40 years or even younger, we can keep them functional for 20 years or more.
Okay.
That is the beauty, because it's the first neurodegenerative disorder which is treatable to this extent.
Okay. And what are the symptoms of it?
Tremor, which I said, which is kampan, which is shaking, and the other one is rigidity, stiffness, and then they become slow. They walk with a bent pace. They have difficulty in writing. The size of the letters become small. They have difficulty in smelling. They are not able to smell as well as other people. What they actually have for many years before also, they can have dreams, very vivid and active dreams in the night. Later on, they develop hallucinations, seeing things which are not there. They can have memory losses. They also have constipation. Now, you have to be very careful here that not everybody who has got constipation for many years is going to get Parkinson's disease, but most of the patients of Parkinson's disease have constipation. These are some of the, they can get muscle pain, backache, which many years later you realize is because of Parkinson's disease. Because when you treat Parkinson's disease with syndopa or levodopa, they become much better. So this is the classic manifestation of Parkinson's disease. Okay. Slowness, stiffness, bending, and having a difficult tremor. Not everybody has tremor, 80%, 20% don't have any tremor at all. But they all have one cardinal feature, is that they tend to be levodopa responsive. Okay. When you give them levodopa, they get better. Initially for many hours, then slowly with time it becomes less and less, from 6 hours to 5 hours to 4 hours or 3 hours. And in between they become slow, stiff. So that's called off. On is when they're like, you put petrol in the car moves. So it becomes agile, you become free, you able to do your day-to-day work. So that period becomes less and less with time.
Okay. Doctor, I would like to ask you that is it a problem happens in the age of old age, or is it like young people can also suffer from this problem?
Unfortunately, we used to think that only older people got this, but now we see more and more younger people getting this. People in their 40s, people in their 30s are getting this problem. So while the vast majority, 70 to 80% would be older, there are quite a big chunk of people who actually get it in the younger age. And since you're working at that point of time, you have a family to look after, you are the breadwinner, our job as doctors, as neurologists, is to keep you functional. And how do we keep you functional? First few years, we manage with drugs. Unfortunately, this is a progressive disorder, as I said. We cannot stop the progression worldwide. And the tendency is to keep on increasing the number of tablets. So levodopa we give from 3 to 4 to 5 to 6 to even 10, 12 tablets. Then we add a second drug, a third drug. and the disease gets getting worse and worse. So after a few years, the best way to manage this is to have surgery. Surgery, the best surgery today is called deep brain stimulation. While there are other modalities like a apomorphine pump, like a jejunal implant for very advanced cases, those are very expensive. Apomorphine pump costs about 60,000, 30 to 60,000 a month. But DBS is expensive, but it gives you a lot more freedom to do things much better.
ओके ये जो पार्किंसन डिजीज है ये जेनेटिक भी हो सकता है?
हाँ, ये जेनेटिक्स होते हैं 10% में, यानी कि 100 पेशेंट्स में से 10 में फैमिलीज में दूसरे मेंबर को हो सकता है.
अच्छा.
90% के पेशेंट्स जो होते हैं ना, हम लोग सोचते हैं कि उनको ससेप्टिबिलिटी जीन्स हैं, जो उनको प्रदूषण, दैट इज पोल्यूशन, लाइक organophosphorus compounds, pesticides and all that, they are toxins. So those toxins by themselves अपने आप नहीं कर, Parkinson's disease नहीं create करते unless you have susceptibility genes. If you have the genes and you are exposed to the toxins, you can get Parkinson's disease. That is what we think is the majority now of patients getting this. 90%. 10% will have genetics where they have got clear-cut family history, 2 or 3 members getting the same.
ओके से फॉर एग्जांपल किसी औरत को जो एक्सपेक्ट कर रही है उनको ये प्रॉब्लम है तो इज इट अ एडेड प्रॉब्लम?
For added problem meaning in terms of delivery?
Added issue during pregnancy?
Not really. We can manage. With medicines, we can manage most of the thing. And we can carry them through labor. Patients, we can get them mobilized. They will manage them with drugs if required. Later on, after delivery, maybe do the surgery. So that she can look after her children better.
Okay. और इसका मतलब पार्किंसन का एग्जैक्टली डिजीज का जो रीज़न है, कॉज है, वो मतलब पता चलता है एकदम जो सपोज एकदम जब छोटा है कोई, तब अगर कोई सिम्टम्स दिखे उनको तब ट्रीटमेंट कर सकते हैं?
नहीं, ऐसे कुछ नहीं है. बाय एंड लार्ज पार्किंसंस क्यों होता है हमें मालूम है. ये मालूम है क्योंकि एक छोटा सा न्यूक्लियस में न्यूरॉन्स ड्रॉप आउट करते हैं. इसको बोलते हैं सब्सटेंशिया नाइग्रा. उसमें न्यूरॉन्स अगर ड्रॉप किए तो नीचे के जो सर्किट है ना, वो ज़्यादा फायरिंग करते हैं. उसके कारण पूरा सिस्टम डिसऑर्गेनाइज होता है. उसके कारण ये होता है. अब ये जो छोटे, मैंने बोला बहुत कम को होते हैं, जेनेटिक्स हैं, हमें मालूम है कि इनको जेनेटिक टाइप वेरिएंट ऑफ पार्किंसंस है. वो जीन्स को हम निकाल सकते हैं, टेस्ट कर सकते हैं, लेकिन उसको बढ़ने से रोक नहीं सकते. वो सब के सब पार्किंसंस बढ़ते हैं.
ओके. How does Parkinson's disease affect a person's daily life?
See, it is very incapacitating. They get pains. If they're off, they get stiffness. They become slow. They're not able to do things fast. So they become really slow at doing things. They become confused. Their thinking process with time gets affected. So they're hesitant to even take part in social events. They will not go to meetings. They will find it difficult to talk because if you're tremoring, you're slow, people will ask you what's wrong. So they become very self-conscious. Not only that, their thinking process because of multiple drugs slows down. So this affects life in many ways. Obviously, your standing comes down, you're thought of as an old person, you're thought of as an incapacitated, invalid, but actually you're fully functional. And once there are doctors who have got these surgeries done. We do this deep brain stimulation, as I told you. And there are doctors operating 10 years, 20 years later. They're doing fine surgery. They do cochlear implants. They do repeated many fine surgeries they do. So you can get them functional. But they still have difficulty. It's not that all of it will go off by doing the surgery. But they get better and they stay much better.
ओके. और इसका मतलब ट्रीटमेंट ऑप्शंस क्या क्या अवेलेबल है? सिर्फ सर्जरी से ही ठीक हो सकते हैं?
First and foremost, the first 3 to 4 years we manage with drugs. You have levodopa and you have dopaminergic agonists and you have anticholinergics. तो क्या होता है कि ये इसमें हम लोग स्लोली इंक्रीज करते हैं जैसे नीड बेस्ड. अब पहले या तो आप डोपामिनर्जिक एगोनिस्ट से स्टार्ट कर सकते हैं, लेकिन ज़्यादातर आजकल हम लोग लीवोडोपा दे रहे हैं. वो आहिस्ता बढ़ाते हैं और उसके साथ कुछ सालों टू मेक इट स्मूथ इफेक्ट को हम डोपामिनर्जिक एगोनिस्ट देते हैं. और एंटीकोलिनर्जिक्स जिनको ज़्यादा कंपन हो. ओल्डर एज में इनका साइड इफेक्ट ज़्यादा रहता है, तो यू हैव टू बी लिटिल बिट मोर केयरफुल. गिव मोर लीवोडोपा देयर एंड लेस डोपामिनर्जिक एगोनिस्ट. अब क्या प्रॉब्लम है कि ये डोपामिनर्जिक एगोनिस्ट में ऑन ऑफ, मैंने जो बोला ना ऑन ऑफ, वो कम होता है. बट उनका इम्पल्स कंट्रोल डिसऑर्डर्स बहुत ज़्यादा होता है, तो उसमें बहुत प्रॉब्लम होते हैं. तो जैसे एक्सेसिव स्लीपिंग में, ड्राइविंग यू कैन फॉलो स्लीप, यू कैन गेट एक्सेसिव gambling, you can make very many rash decisions. You can suspect the fidelity of your spouse. बहुत होते हैं ऐसे problems. And entire families can disintegrate. तो ये सब कम करने के लिए, बंद करने के लिए हम लोग सर्जरी की तरफ जाते हैं जहाँ साइड इफ़ेक्ट्स कम है, क्योंकि दवाई कम कर सकते हैं नंबर 1, जैसे कि हाइलुसिनेशंस कम हो जाते हैं, ये सब कम हो जाते हैं. नंबर 2, इनके जो मोटर मूवमेंट्स है ना वो ज़्यादा हो जाए. दैट गेट्स बेटर, much better.
Okay.
So you have army of, actually you have policemen who are getting promoted from to become from there are many policemen at sub inspector. They've gone on to become DSP, SP. Okay. Getting surgeries done. So they're functional, which is what you need in a society to keep them functional. That is manageable as far as all the neurodegenerative disorders goes. Parkinson's is much better now compared to before.
Okay.